Imagine being in pain, not being able to fix that pain with another or a good night's sleep, but not being able to pay a visit to your doctor because of the exorbitant costs. Imagine new parents not being able to feel the joy of welcoming a new member into their family because they have to stress about and worry about hospital bills that they will start getting as soon as they get home. One of these people could be someone from your family or someone you know. 47.9 billion people in the United States did not have health insurance in 2012. According to the U.S. Census Bureau, this is 15.4% of the U.S. population left to fend for themselves faced with the healthcare crisis. 40% of the people in the terminal stages of illness say they are worried about how to pay their medical bills, and according to statistics, about 6.8 thousand infants die every year in the United States. These deaths are a tragedy to tens of thousands of families and are anxiety-inducing for millions of other mothers of infants. The United States has failed citizens when it comes to healthcare. Our interest in an affordable healthcare system comes from our experience knowing of people who have suffered in silence because they couldn't afford a visit to a doctor's office, of moms who have seen their babies have this world in front of their eyes, or moms who suffered from complication during labor because they didn't have access to prenatal and postpartum care. And also from my interest in this matter as a healthcare management major. Next slide, please. Hello, everyone. My name is Bushra Sirwa, and this is my partner, Anna Pandit. And today we will be providing an argument showing why the United States should grant universal health care to all its citizens. Next slide, please. The absence of affordable healthcare has not only degraded the quality of the life of the general population, but has also fueled an increase in the already sky-high prices due to inaction from the people or the government. According to an article in the International Journal of Health Services, the commercialization of care in the United States has driven up costs by diverting money to profits and fueling a vast increase in management and financial bureaucracy, which now consumes 31% of total health spending, showing a for-profit health institution provide inferior care of inflated prices. According to a new Michigan medicine-led study in JMA New York Open, low-income women encounter gaps in health insurance coverage before, during, and after pregnancy. And this insurance terms may make it less likely that they receive prenatal care in their first trimester or postpartum visits compared to those with steady insurance. Lindsay Andom, a gynecologist and researcher at Michigan Medicine von Volklanter Women's Hospital, said that the insurance stability may contribute to the alarming disparities that have been seen in maternal and child health outcomes. Now we'll pass the floor back to my partner, Anurag, who's going to explain to you all how a universal healthcare system could be a solution to all of this and how it can be implemented.
Okay, one proposed solution to this is affordable or universal healthcare. According to WHO, universal healthcare coverage means that all people have access to the health services they need when and where they need them without financial hardship. It includes the full range of essential health services from health promotion to prevention, treatment, rehabilitation, and palliative healthcare. The Medicare system that was introduced is a type of universal healthcare coverage. Though not available to everyone, it provides a base for where we need to start, though, through which the coverage can be expanded to all of the population. But this alone is not enough. The universal healthcare coverage, if enacted, would place a huge burden on the economy, which might even collapse later on, sending us back to square one. According to an article on Johns Hopkins Bloomberg School of Public Health, researchers determined that the high overall healthcare spending in the US was due to mainly higher prices, including higher drug prices, higher salaries for doctors and nurses, higher administration costs, and higher price for other services too. This can be seen as why the US spends 145% higher than the OECD countries. What needs to be done in addition to pegging down the prices of medical procedures and equipment to the supplies to the international market, which if implemented would result in a top-tier affordable healthcare in the United States without spending anything more on healthcare. Next slide. Our country unfortunately does not have the uniform healthcare system and has no universal healthcare coverage. But in adopting one, Americans won't have to face difficulties in finding a good doctor because the excessive price of some doctors that charge patients has caused many people to stop getting health services, as we can see in the figure. Deprived communities will finally be able to have access to primary healthcare services and won't have to rely on emergency departments to treat chronic and preventive diseases. According to US health experts, the cost of new technology and prescription drugs has risen, and with the universal healthcare coverage, many will not have to worry about the costs. One might argue that affordable healthcare might reduce its quality, increase taxes, hamper innovation due to the lack of free market, but no matter what these arguments say, none of them hold any ground. There's people who haven't had to face the stone cold reality of needing medical services, yet not opting it in face of monstrous debt they need to cover these costs. According to an article published in the March of current year by Tracy L. Adams and Kathleen Wanamaker, specialists in the Department of Sociology of University of Ontario in Canada, compared the pandemic responses in 3 countries, Canada, Australia, and UK. Systems in these nations are now thriving because their people do not have to worry anything else other than getting back to full recovery. Their innovation didn't slow down, and AstraZeneca was one of the first COVID vaccines we saw, and it was extremely effective as well. Now, I'll pass on the conclusion to my teammate, Busra.
Thank you. We urge you today, our audience, to act and take action. We will be passing around petition for a universal healthcare for you, the audience, to sign, and with the promise that we will do our best to get this signed petition to our county's representative and discuss with them the idea to pass it into a bill. Let's take action together. Please sign the petition and save yourself by 7 others. We appreciate your contribution, and we thank you so very much for your interest. Thank you.